We are going to start to get back in the habit, unfortunately, of doing COVID updates because it's about to become a bigger and bigger part of our lives. And I'm going to continue to show you why that is and what we're doing differently today. I will keep going back to the national map, which looked like this in spring and looked like this a month ago. And the red are the areas of infection. And there is no question, they have now spread all the way up through Indiana, starting to come up through southern Ohio. Of course, you've been watching on the news, Florida, Arkansas, Louisiana, Mississippi. Florida's August is going to be Michigan before the end of fall. All of those images you're seeing, it is heading our way. And so, what can you do? We're going to continue to give everybody options that wants to protect themselves. The hospitalizations, this is the last month. They have more than doubled, almost tripled, from 35 in the hospital to nearly 90. That's in 1 month. If they triple again in the next month, we're going to be into serious issues. And at this point, there's every reason to think that's where they are going. And so we began offering the third shots. The people who did the right thing, who wanted to protect themselves, who went and got their shots, we started offering the third shots. We've been doing about 500 a day. The TCF Center, that's great. Starting today, if you got your first 2 Moderna or Pfizer shots, at least 6 months ago, you can go to any one of our 10 community locations. So you can go to all of these places and go in. You don't need an appointment. Just walk in and you are in the system. They call it the MICR system. They'll look you up. You will be able to get the third shot on site. So all of these centers, TCF, Farwell, Samaritan, Clemente, Clark Park, Northwest Activity Center, and then in the weekends at Greater Emmanuel, New Providence, Galilee, and Triumph Church. So if you're immunocompromised, go in, get a shot. You don't need a doctor's appointment, you don't need a note, you don't need a prescription. Go in, get your third shot, because we know after 6 months, that vaccine, those Moderna and Pfizer vaccines that are so amazing, in the first 6 months, they start to lose their effectiveness. Now, on September 20th, everybody ought to be getting the third shot. But right now, if you have something about your body that makes you more vulnerable to infection, you can get in at any one of these 10 locations. And all we're going to keep doing as things get worse and worse is make the vaccines more and more available so that those who protect themselves will have a perfectly normal life this holiday season, and a lot of the others, there's no other way to say it. You're going to be with family in the hospital. And just turn on the national news if you want to see what's coming. And I know Denise Fair is doing just a phenomenal job, she and Iris Taylor. But we told you before, this works just like the original vaccine. You can make an appointment if you want, or you can just walk in now. You can bring your vaccination card, but if you don't, we got you in the system. And you get the third dose of Moderna or Pfizer. So if you got 2 Modernas, we'll give you a third Moderna. If you got 2 Pfizers, we'll give you a third Pfizer. Johnson & Johnson has just released research that they need a second shot. We don't have a whole lot of Detroiters that got it in the first place, but as soon as the FDA approves Johnson & Johnson for the second shot, we'll offer that as well. So could not be easier, and if you bring somebody you care about, you get a $50 certificate. This month, we finally got back to public meetings. The infection rates were down enough that public meetings occurred with government, but Director Fair, because of what we are seeing right on the charts that I just showed you, September 1st, we're going back to public meetings by Zoom. And we're going to stay that way until this next wave abates. So be conscious. And the FDA has now fully approved the vaccine. If you've been thinking about it, and we'll keep saying this, you get your Pfizer shots 3 weeks apart, you get your Moderna shots 4 weeks apart. If we get hammered this fall with a COVID pandemic, and it's coming up through Indiana, if you wait 4 weeks to get the vaccine, do you see if it really crosses the border, it may be too late for it to take effect. The other update I wanted to give you today is about the response to the flood crisis. And let me start by saying a great thank you to the men and women of the DPW, the General Services Department, the Water and Sewer Department, and everybody else who responded to this unbelievable flood. DPW went out and picked up 33,000 tons of debris from curbside. That's over and above the regular bulk pickup. What they accomplished was remarkable. People in the city, I know I've heard from a lot of people who said they came through one day and the next day, you wouldn't have known anybody had been down the street. Our whole block was filled up again. They came through and they did it again, and they did it again. They're going to continue to do it for a couple of more weeks. And for the elderly and the handicapped families who needed help cleaning out their basements, we have now, between the General Services Department and the Detroit Water Department, gone in and cleaned out the basement of 2,700 families in this community. And so for the men and women who did that, I just want to say thank you. We've heard appreciation from neighbors everywhere. President Biden on July 15th did a declaration of emergency, and we're 5 weeks later, and FEMA has already approved $56 million just for Detroiters. It's $100 million for the region, but $56 million for Detroiters in 20,000 households. And so it has been an extraordinary quick response. And then the Small Business Administration has approved another $60 million in loans for 2,000 folks who applied for those. To see the federal government respond at this speed has been a remarkable thing. We're getting past the emergency, and the Detroit Water Department now is commissioning a study to analyze what we do to make sure this doesn't happen before. How do we protect the basements? Do we separate the storm water from the sanitary waters in our low-lying areas on the far east and west side? And I expect before the end of the year, we're going to have engineering recommendations, and then we will roll out early next year plans so that hopefully we can start to protect folks before next summer comes. I don't know whether this was really a once-in-a-100-year storm or it's coming again next summer, but we are going to take action to give you every protection we possibly can before we have to face this again. If you need help, FEMA's here through September 13th. So you've got a little more than 2 weeks, and after that, they're gone, and your opportunity is passed. And I'd encourage you to go to the centers. If you got any questions, you've been turned down, go down to Go Lightly in Kemeny. I don't know how many people I've talked to who had a problem. They went into these centers, and the FEMA staff were terrific at talking our residents through the forms, showing them how to get help. They didn't fly in here to say no. They flew in here to get the $55 million into residents' bank accounts to help you deal with this. So they're going to be here for a couple of more weeks. Please take advantage of them. I don't know that we'll ever see a response that was any quicker than what we saw. One more thing that you need to know is on bulk pickup. And we have certainly seen some people that weren't in flood areas take advantage of our continual bulk pickup and put out bulk that had nothing whatever to do with the flood. We decided not to argue about it. We've just been picking it up. But September 3rd is going to be the last day for daily bulk pickup in the flood-affected areas. After that, we're going to be back on the regular bulk pickup schedule. And if you put it out every day, you're going to get ticketed like you would have before. So if you still have debris from the basement and you want it out quickly, get it out by September 3rd when we're doing the daily flood pickup. and there'll be a lot more notices on this, but we're now starting to hear from neighborhoods, as you would expect, how come the bulk is being put out every day of the week. We're going to get back to the normal schedule of the city in just about 10 days. And so we're going to deal with COVID, we're going to deal with the flood aftermath, and pretty soon, I'm hoping, we get back to just spending all of our time on the day-to-day business of the city. And with that, I want to turn it over to the health director, who's done just such a great job throughout this pandemic, Denise Fair.
Thank you, Mr. Mayor. I want to just take the time and reiterate a few points that the mayor already highlighted. But our vaccination rate continues to be pretty low, and it's below the level that we need to achieve community immunity of 70%. Roughly 100 Detroiters every day are getting COVID. This is up from just a few weeks ago when we were at about 50 cases per day. And according to the CDC, we are still at a substantial rate of transmission. So as the mayor indicated, in regards to the Open Meetings Act, effective September the 1st, restrictions on the Open Meetings Act will go into effect and remain until December 31st of this year. What this means is that all public meetings of governmental bodies will be held remotely, so everyone who is either vaccinated or unvaccinated can participate and feel safe in these meetings. And we're doing this to protect the public's health in order to reduce the transmission of COVID-19. And finally, let me just remind all Detroiters, we are still in the middle of a pandemic, and we need all of us to remain and be in this together. So please wear your mask when you are in indoor public settings, and please consider getting vaccinated. Talk to your friends and family, hear their stories of why they got vaccinated. And if you have questions, don't hesitate. Give us a call right now, 313-876-4000. We have a clinical team standing by to answer all of your questions. And so with that, I'll turn it back over to the mayor for questions.
All right, anybody have any questions?
Mayor, if you could talk about the, All right. Mayor, I have quite a few questions for you today. First, I want to address yesterday's investigation of City Council. How concerned are you about yesterday's search and how it could impact the election?
I don't know about how it impacts the election, but it's certainly discouraging for the people of the city of Detroit. It's never good when the feds are delivering search warrants. We need to remember these are search warrants. Nobody's been charged. I was a prosecutor. There have been lots of cases where you do a search warrant, you gather the evidence, and you find out there has not been a crime committed. In other cases, you do a search warrant and you gather evidence that makes your case. But at this point, nobody's been charged, and I'm going to withhold a judgment until I see what develops.
What's your take, on your potential allies in the next election being under scrutiny, if anything comes out of it?
So when you say my potential allies, for the last 8 years, I have not vetoed a single action of city council, which I think is pretty much unprecedented. I've got an excellent working relationship with all city council members, and I will have a good working relationship as I continue to have. So at this point, all I know is that there is a search warrant, and I don't know anything beyond that.
So you didn't hear about the FBI being tipped off about your colleagues beforehand?
I have not heard about the FBI being tipped off. The feds have not shared with me any details of their investigation. I saw that the Detroit News reported yesterday that this appears to be focused on towing. Feds have not shared that with me, but my observation is that's likely to be true. And so I spent some time with Chief White today. The federal government will run their course, and we have this U.S. Attorney's Office, very professional operation, but there are things the city can do, and we need to finish the job of cleaning out the unscrupulous towers and dealing with this rotation permitting system once and for all. This is the third federal investigation in 4 years. that has arisen from this towing operation. In 2017, we had a deputy police chief from this department who was convicted and served a year in prison for taking bribes to change the rotation among the towers. 2017, we also had 6 police officers indicted for taking bribes for towing rotations. All 6 were convicted, and this stems from a decision in 2011 and 2012 not to competitively bid the towing in this town, but to create a permit system with a preferential group of people in a rotation that people don't fully understand. It is a system fraught with potential for abuse. So in 2017, we tasked a young assistant chief by the name of James White with the job of cleaning it up. And Assistant Chief White came back with a 4-point plan, and we've implemented 3 of the points. First, we terminated the contracts of several towers because of what we believed was inappropriate behavior. They all sued us, but to my knowledge, we've won, and we've kept them all out. Second, we changed the practice by which a tower could find a stolen car and then claim the tow work. And we had evidence that it appeared some of the towers were in cahoots with the car thieves. And after we stopped that practice of allowing people to find stolen cars and get the towing fees, the car theft rate dropped significantly in the city in the next year. And the third thing that we did was Chief White implemented a Detroit Police Department towing operation, which, if you were here, was a great deal of controversy. But we today tow 25% of the vehicles with the Detroit Police Department because I wanted to be in a position that if we could not clean up the behavior of the unscrupulous towers, I wanted to have the ability to take it all into the Detroit Police Department and get this problem behind us for good. We were in the process of the final step, which was to eliminate the preferential rotation altogether and go to an open competitive bid, in which case you'd have transparency on all of it. That got paused earlier this year. And so I sat with Chief White today, and I said the feds are going to do what they're going to do. They're not going to talk to us, nor should they. But there's still something we can do. And we've created this atmosphere where there is so much money involved. And people in this town know it's not just the towing fee, it's the storage fees. The amounts of money that are involved are just breeding potential for abuse. And I'm going to be leaving for a vacation for a week tomorrow, but I've asked Chief White in 2 weeks to bring me a plan to eliminate this towing rotation practice once and for good, and he's in full agreement that's the next thing we need to do. So I'm going to do my part and deal with this towing rotation system, if that does indeed turn out to be what this is about, so that we aren't 4 years from now having to deal with any more investigations, because it just isn't good for the city.
Thank you, Mayor. A couple questions about vaccinations. Correct me if I'm wrong, but Detroit isn't halfway vaccinated yet. and
About
we're talking-
43%.
Yeah, so we're talking about a 3rd shot. How do we get more 1st and 2nd doses?
You know, it's the question all across America. But I was one of the ones lobbying for President Biden to approve the 3rd shot. And to me, you have a lot of people, almost 250,000 people in the city have done the right thing. They've gotten vaccinated. But those vaccines, which are medical miracles the first 6 months, do start to lose their effectiveness as you get to 7 and 8 months. And my point to the president was the people doing the right things and protecting themselves, they need to have the ability to make sure, because you're seeing this in Florida. The folks who have been vaccinated, you've got people getting sick. They don't tend to be hospitalized, but they're still getting sick and can still spread it to others. And so we're going to do both things. The 3rd vaccine is going to be readily available for everybody who did the right thing the first time. And hopefully with the FDA approval, we'll get more and more people to be successful at trying to persuade their loved ones to come in.
My last question for you. Do you know which neighborhoods have lower vaccine rates, and do we know why?
I don't know, Denise, do you have those numbers?
I don't have those numbers available.
Yeah, I'm not sure if we have them by zip code or not. If we do, the health department can get them for you.
Okay, thank you.
Anything else?
Thank you, Mayor. Eli Newman, WDET. Not to belabor yesterday's news, but Council Member Raquel Castaneda Lopez is pushing for an amendment calling for the addition of ethical standard trainings for elected officials. Is that a policy that you would endorse?
I don't have any problem with that at all, but right now, the Ethics Committee does annual ethics training. There's already a commission that does it, but if she has additional curriculum she wants to add, I don't have any objection to that.
Sure. And concerning, back to the flooding, have you heard anything about any potential disparity in terms of what individuals are receiving from FEMA, from Detroit versus the suburbs?
No.
I was speaking with a woman who had received $1,500 in the Warrendale neighborhood, has extensive damage to her home. I mean, are there other pathways for repairs that
Yeah.
someone like
So-
that could take?
So you've got multiple issues, but FEMA covers emergency response. So what does it take to clean out if you lost your hot water heater, if you lost your furnace? Depending on the situation, you may or may not have a DWSD or a GLEWA claim, and most people have filed. And then beyond that, even if you don't get a cash grant, there's the potential to get very favorable SBA loans. All of those things are available. But FEMA would have to answer those questions, and they could answer the question about why a particular amount. To put out $56 million in 5 weeks is pretty remarkable. That's just the residents of the city of Detroit.
Sure. And I have a couple questions for Director Fair, just regarding the city's policy towards vaccinations and mask mandates. Can you outline what city employees are required to do and not required to do in terms of wearing masks, if they're reporting in for work or just reporting their vaccination status?
So my understanding, this is led by Hakeem Berry and Denise Starr, but we are encouraging, actually we are mandating all city employees to wear their mask when they are indoors. And that was just recently put into effect about 2 weeks ago to slow the spread of COVID-19. So far, from my own assessment, employees are very much open to wearing the mask, and we are encouraging them to follow suit. We're also recommending for those who are unvaccinated to get vaccinated very quickly, and we are also instituting biweekly testing for those who have not received their vaccination.
Sure, but there doesn't need to be a reporting of vaccination status.
We have.
Yeah,
Oh.
from the health department.
Okay, so there is that. I was wondering if, just with what we've seen with the Open Meetings Act pandemic order, if you're considering, implementing something a little bit stronger as we're seeing this surge, as we're dealing with a very low vaccination rate in the city of Detroit.
So we're going to follow the direction of the governor. At this time, what we have implemented is what I just mentioned.
Okay, thank you.
Yeah, but to be clear, we know the vaccination status of every single employee, and those who are not vaccinated are required to get a test every 2 weeks. Any other questions?
Tim Baker with Fox 2. President Biden authorized the $1.9 trillion spending measure, the COVID relief package. 9% went to we the people, 91% went to the states, I assume. Has any percentage of that funding come to the city, and what are you using it for?
Yeah, it came to the city a year and a half ago. City council appropriated it, and
I thought it was like this past May, wasn't it just more recently?
you may be talking about ARPA. So there's been multiple phases. The CARES Act came through last year. Council appropriated it. The American Rescue Plan money came through. We held 63 public meetings, and the last week of June, council appropriated that, and that information on all those details are available to you from the Budget Department. All right, anything else? Thank you.